It's been 6 months since I had a parotidectomy. So essentially, I had a tumor, benign tumor, thankfully, on my parotid gland, and part of it was removed because of that tumor, and I do have the scars for it. It's very hard to see, but like it's up from here all the way around here, and I'm still actually dealing with 6 months later, like some numbness around my ear and my jawline, and it does have some tingles here and there. But I want to say my story of how I learned about this and how people like it's how important it is to like really manage your health and take care of yourself. So story time is around early 2025. I noticed that I had a bump around my jawline, right under my ear, and was there for quite some time. But I've always like thought of it as normal. But then when I was trimming, it just felt more and more noticeable, and I just felt like there has to be a reason why. I went to a dentist actually, said, "Is this like some tooth or something that's like in the back of my jaw, like it has come out?" He's like, "No, I don't think so, but you should talk to your doctor about it." So I did. My family doctor told me to get an ultrasound, and I did, and he saw the results and called me up like straight away. He said, "Hey, I see this results, and I think there could be a chance that it could be cancerous, but I don't know. You have to do some more tests. So I'll give you I'm going to request you to do an MRI, an X-ray, or some sort of X-ray, I think. And also, he told me to, uh, he got me a specialist as well for ENT, which is ear, nose, and throat, I believe. So I got my tests as well, and I went to the ENT doctor, my surgeon actually, who would be my surgeon, and she essentially saw that this was a very common thing, but there is a chance that this is a tumor, but or for that could be cancerous, but we don't know. She had to do a biopsy on the spot, and she told me as well, like there's no real cause for this, like it just happens. And one of the things that these things when they do happen is that if it goes untreated, it can become cancerous later on. So it was good that I got caught it now rather than later, and it was becoming more and more noticeable. So I had to like get it done, and since it wasn't cancerous, there was a bit of a 6 month waiting list for me to get my surgery. And that once that surgery did pass, I had to say like it was fine. Like I had a good surgery, everything went well properly. I had to be in the hospital for 2 nights because there was a tube coming out of me, and now I'm just because they're draining blood out of me. But again, it was fine, and like at the end of it, like I did get the scars for it. But I have to say, like that was an interesting experience all in all. Like I'm still dealing with some of this stuff of the thing. I do feel sometimes weird